Today I want to talk about this medical device. What do you think this is? It's small, but useful and beneficial. This device is called an IVC filter. What is an IVC filter? And when is it used? Placing an IVC filter requires us to go through the placement steps one by one. I am Dr. Habibi, international cardiologist. Today we want to talk about the IVC filter and everything you need to know about it. From the indications for using an IVC filter to the step-by-step placement procedure. As its name suggests, the IVC filter is placed in the IVC or inferior vena cava, and it prevents the movement of thrombi and clots that accumulate in the lower limbs and are supposed to travel to the heart through the IVC. Therefore, it prevents pulmonary embolism. As you know, one of the dangerous medical conditions is pulmonary embolism. Pulmonary embolism means that blood clots from the lower limbs enter the heart and are then pumped into the lungs, making it the fourth leading cause of death among hospitalized patients. The most common place where a thrombosis or clot breaks off and causes an embolism that enters the lungs is the veins of the lower limbs. Because in the veins of the lower limbs, blood tends to become stagnant and remain in place, which leads to the formation of thrombosis. Patients whose activity has decreased for any reason, whether due to surgery, trauma, or being bedridden, are prone to developing clots in the vessels of the lower limbs, which we call DVT. Patients who have DVT, these clots may break off and lead to a pulmonary embolism. So what is the treatment for DVT and pulmonary embolism? The main and primary treatment is anticoagulation, meaning we administer blood-thinning medications. However, in some patients, we are unable to give them anticoagulant medications because one of the side effects of anticoagulant drugs is causing bleeding. Therefore, if a patient has just undergone surgery and we give them anticoagulants, they might bleed from the surgical sites. And if the surgery has been performed in a critical area, such as the brain or nervous system, any bleeding can lead to the patient's death. So we end up facing a therapeutic dilemma. On one hand, if we don't give the patient anticoagulants, we put them at risk of pulmonary embolism. But if we do give anticoagulants, there's a risk of bleeding. So what should we do in these situations? The treatment in such cases is to place an IVC filter. Now, regarding the placement of an IVC filter, first we need to know where exactly we should place this filter. The appropriate location for placing the IVC filter is between the renal veins and the iliac bifurcation. When it is placed here, it blocks any thrombus that tries to move upward from the lower limbs. The IVC filter is a metallic device made of stainless steel or nitinol, and as you can see, it does not completely block the vein. Due to its mesh and network structure, it only stops large thrombi. Where exactly should we place this filter in the IVC? Where is the best place to insert the IVC filter? Below the renal vein and above the bifurcation of the IVC. Why don't we place the IVC filter above the renal vein? Because if it gets blocked by a thrombus, the kidneys can still drain their blood, preventing kidney failure. There are different types of IVC filters, but the two most commonly used are OPTs and ALN. These are the two main forms of IVC filters that we use. The IVC filter prevents thrombi from moving upward toward the heart and blocks pulmonary embolism. To ensure that the IVC filter stays in place and does not move toward the heart, it has a series of metal-like projections at its upper part that embed into the wall of the IVC, and they are one-way, meaning they prevent upward movement. These are called fixation barbs, meaning they hold the filter in place here. If you found this video helpful so far, please like it and share it with your friends. And if you don't want to miss my future videos, please subscribe. What are the indications for placing an IVC filter? There are three main indications. 1. Any patient for whom we cannot administer anticoagulants for some reason, such as someone who has had surgery, has active bleeding, or has experienced trauma, and if we give them anticoagulants, they will bleed from those sites. 2. These are patients who, despite us giving them anticoagulants, still experience recurrent PTE. In other words, they have repeated pulmonary embolisms. And third, there are patients who have had a pulmonary embolism and their cardiopulmonary capacity has decreased, and when we perform an ultrasound of the lower limbs, we still see some thrombosis present in the lower limbs. This poses a risk that these pieces of thrombus might break off again and cause another embolism in the patient. And this time, with a new embolism that occurs, the patient might not survive.
The IVC filter can be placed through two routes, either via the internal jugular vein or via the femoral vein. The important thing is that in both cases, the site of IVC filter placement should be below the renal vein. Which route is used to place the IVC filter depends on the operator's experience. But in cases where both lower limbs have DVT and both iliac veins are filled with thrombus, the IVC filter is placed via the jugular vein. Because if we try to place it through the femoral vein, when we advance the wire or insert the sheath, the thrombi may become dislodged, enter the IVC, and from there travel to the heart and cause another embolism. The first step in placing an IVC filter is obtaining venous access. We can obtain venous access in two ways. This can be done either with ultrasound guidance or by using anatomical landmarks. The femoral vein is located more medially compared to the femoral artery. Therefore, to obtain access through the femoral vein, it is sufficient to feel the pulse of the femoral artery, and then 1 centimeter more medially and 1 centimeter lower, we proceed to access the femoral vein. After accessing the femoral vein, we place the sheath there. The sheaths that are used for placing the IVC filter, these are long sheaths that we use to enter the IVC through the femoral vein. We position the tip of the sheath below the renal vein and inject the contrast agent there. When blood from the renal vein enters the IVC, our contrast agent is washed away, and this allows us to identify the exact location of the renal vein. Well, as you can see, after we injected into the IVC, the two main branches of the renal vein became visible, and the contrast agent is washed out, meaning it is cleared away by the blood returning from the renal vein. Now, anatomically, how do we determine the location of the renal vein? Based on the shadow of the vertebrae, the renal vein is located at the level of the L1 and L2 vertebrae, and the bifurcation of the IVC is at the level of the L5 vertebra. There are various types of IVC filters available on the market. If the filter is to be placed via the femoral vein, we will proceed according to the direction of the arrow marked on the device. To do this, we place the IVC filter device into the distal end of the sheath at the part indicated by the arrow. And as you can see, as soon as it enters the sheath, blood enters the device. We insert the delivery catheter into the device from the end, hold it firmly with the other hand, and then push it until it reaches the end of the sheath, right? After which we look at the monitor screen to continue the procedure as we continue to push the delivery catheter forward inside the sheath. On the monitor screen, we can see that our IVC filter device is coming out from the tip of the sheath. As soon as its tip emerges, we stop pushing and instead pull the sheath backward over the delivery catheter. In other words, we unsheath it, which allows the IVC filter device to deploy in the correct position. In the next step, to ensure the proper placement and position of the IVC filter, we inject contrast agent to confirm that it is correctly positioned. As you observed, we have placed our IVC filter exactly below the renal vein. The IVC filter is packed in a collapsed state inside a plastic package. This plastic device is called the delivery system. After we insert the package containing the IVC filter into the sheath, we insert the delivery system from the other end of the package and push it until the IVC filter is released. As you saw, the tip of the IVC filter emerged, and usually once we see the tip of the IVC filter under fluoroscopy, we need to perform the remaining steps unsheathed. This means that we no longer push the delivery system forward. Instead, we pull the sheath back. By pulling the sheath back, the IVC filter is released. And this is the moment when the IVC filter is deployed. At the final stage of the procedure, after we have successfully deployed the IVC filter, we remove the sheath and, with slight pressure, hemostasis will be achieved. Another point about the IVC filter is that there is a hook at its end. And after a few weeks, when we plan to remove the IVC filter, we can use this hook to retrieve the filter, snare it, and take it out. Therefore, placing an IVC filter requires us to go through the implantation steps one by one. And by following these steps, the procedure can be carried out completely successfully.